Sir is interventional radiologist practicing at Ahmedabad. Sir has done fellowship in interventional radiology at Gobind Singh Hospital, Jamnagar. He is trained for vascular malformation treatment under Dr. Wayne Yates in USA. Sir has treated more than 12,000 patients with endovenous thermal ablations and foam sclerotherapy procedure for varicose vein. Sir has special interest in genicular artery embolization, cooled radiofrequency nerve ablation for knee pain. Over to you, sir.
Thank you so much for a nice introduction. So let me have my first slide, please. Yeah. So first of all, I would like to congratulate not for only organizers, but for inviting me for this talk, but also for a very large audience on this last topic of this conference. So congratulations to all the organizer committee. So I am a last batsman of this one day, and let me make it it's more interesting with a little bit story. And this story, this journey, we started together, me and my partner, Dr. Rosil Gandhi, just 2 years back. And આપણે ઇન્ડિયન્સ છે ને એવું થોડા જુગાડી બહુ હોઈએ છે આમ ડૉક્ટર પાસે છેક છેલ્લે જઈએ વિચ આઈ હેવ સીન ઇન માય પેઇન મેનેજમેન્ટ સ્ટોરી વી ફર્સ્ટ ટ્રાય લોટ્સ ઓફ અધર થિંગ્સ ઘણા બધા પેશન્ટ્સ મેં રોઝીલે જોયા છે જેની અંદર પેશન્ટ્સ કમ વિથ ભુવા પાસે ડામ લઈને આવ્યા હોય ટુ રિલીવ ધ ની પેઇન દે હેવ ટ્રાઇડ સો મેની જેની કોણે બનાવી છે શું કરીએ બાયોગ્રેડિયન્ટ શું છે કશું જ ના હોય મંદિરના ઓલા ઓટલા પર કોઈ સાધુ બેઠા હોય ને એને કોઈ પડીકી આપી દેટ ઓલ્સો દેવ ટ્રાઇડ ફોર પેન રિલીફ ઇવન ધો માલિશ ઓર હવે અત્યારે આપણી ઇન ધીસ ન્યૂ એરા ઓફ મુખ્યમંત્રી અમૃતમ કાર્ડ દેર આર લોટ્સ ઓફ patients, young patients, 35-40 years old, go for the knee replacement to relieve the knee pain. But actually it's very sad. But what if this all jugaad fails? So then come to interventional radiologists. So this is very important thing. And why to come to interventional radiologists, right? That is one story behind it. So these are WHO pain management ladder. And if you see this graph, everything is based on to reduce the symptom of the pain. Nobody has tried to rule out the root cause of the pain. So gradually, in WHO guideline also, they increase the dose of the painkiller and ultimately at the end, they try to use the nerve blocks. But the root cause is chronic inflammation. And we find it out, this root cause elimination, and there's one story behind it, that people have addiction about the different social media like Facebook and Instagram, now new TikTok, but personally I have very addiction of the Twitter. And exactly into this COVID era, in March, I think 2020, the COVID lockdown started. And this young fellow of Dr. Yuji Okuno, he's an interventional radiologist from Japan. And I have seen one tweet on the April 2020, and he has mentioned that there's some abnormal blood vessels seen at the site of joint pain. And he has defined it as a Moyamoya blood vessels. So what is a Moyamoya blood vessels? Moyamoya is a abnormal blood vessels in the language of Japanese terminology. And similarly, the Moyamoya blood vessels, he has find it out that it is very commonly find into the joint pain, whether it's a knee, whether it's a heel or frozen shoulder. Wherever there's a pain, there is a Moyamoya blood vessels. And later on, 4 days later, he has shown at the April 24, 2020, he has again done one more tweet, and he has shown his case of the jumper's knee on the Twitter. And I'm a little bit excited, and I would dig it deeper and deeper. I've gone through lots of research, lots of papers. I think I've shared with the Rosil that actually we have to understand as an orthopedic point of view about the joint symptoms, and that because of the COVID, I was literally we have lots of time and all this knowledge acquired during the COVID era. So now, what is the Moyamoya blood vessels and why it occurs? So as per the research of the UG Okuno, the per square foot blood vessels into the any part of the organ, it is enough to supply the nutritional uptake. But whenever body has to do something new, like inflammation or something like that, body generate these new blood vessels. And the diameter of these new blood vessels is far lesser than the normal blood vessels. So these Moyamoya blood vessels are diameter of around 40 to 70 microns. And how it creates the pain? It creates the pain by releasing the toxic cytokines, which is damaging the joint capsule, or any other part of the joint. And the second one, by irritating the sensory nerves, which also develop along these arteries. So if we eliminate these Moyamoya blood vessels, then the chronic inflammation stops within the joint, and it will eliminate the root cause. So our target is to release chronic inflammation, and this is what our journey begins. Me and my partner, Dr. Rosil's journey begins, and this was our first case. We have done in October 2020, and it was well reported by so many media that this patient actually came with એને બુઆ પાસે લગભગ બંને ઘૂંટણમાં 12 થી 16 જેટલા ડામ લીધેલા હતા, and it is very painful situation to burn your knee. And still she was so much desperate to not going for knee replacement surgery. And we have done, I think so, we have done it in October 2020. She is still pain-free. And this was our first case, and then later on, right now, we have done more than 250 joints. And let me show you a few examples. Like these, so over here, these are pre-embolization picture. These are Moyamoya blood vessels, and the post-embolization, you can see the main arteries intact, but the abnormal blood vessels is disappear. And by doing this embolization, the pain is significantly reduced. So these are 56-year female, severe knee pain, difficult to do, routine household work, consulted multiple orthopedic, all have advised the TKR. These are very common history. Whenever the patient comes, the patient has consulted so many orthopedic surgeons. And obviously, they have advised the TKR because they know only the one weapon, there is a knee replacement surgery. But now, as an interventional radiologist, we have introduced our new weapon, that is genicular artery embolization. And what we have applied in this case, we have done the genicular artery embolization, and now she is pain-free. So another case, this patient is 90-year-old, not suitable for any surgery, because not only because of the age, but he is also suffering from atrial fibrillation and KL grade 4 osteoarthritis. Usually, me and Rosil, we don't touch the KL grading 4 osteoarthritis because KL grading 4 osteoarthritis patient has osteogenic pain, and we don't see so much successful results into the KL grading 4. But we have done this because in 90 years of age group, the mobility requirement is very less. It is required limited to his home only. And we have done genicular artery embolization, and Vasco reduced from 10 to 4. And he started his routine work into the home. So these are rheumatic arthritis patient, and known case, severe pain in knee joint. Even the night also, she is not able to sleep. She is not confident to walk also. She is suffering from lots of severe pain. And all the rheumatic arthritis medicine is not working. She is not getting any pain relief interval. And after genicular artery embolization, she is pain-free. I'm not going to show the repeatedly over here. These are typically on the left side. There is a pre-embolization picture. There's a Moyamoya blood vessel, which is very well seen by this arrow. And the right side, the normal vessel is still intact. Normal genicular artery is still intact, but the Moyamoya blood vessel is disappeared. So again, these are jumper's knee, and these are athletic person suffering from jumper's knee, pain around the kneecap. Last 4 years, he has been shown to 30 orthopedic of Gujarat, Mumbai. He is very big shot, and there is no result. And we have done genicular artery, and now he is pain-free. So these IT band syndrome, as a routine radiologist, these are very difficult terms because we are not used to with the iliotibial tract band syndrome or like that. But we have to learn to, if we are going to treat this such kind of patients. So the patient was suffering from iliotibial band syndrome since 1 year, severe pain in outer side of the knee joint, pain increases with the activity, and after genicular artery embolization is pain-free. So these again, pes and serine bursitis. Patient has a pain into the medial side of the knee joint and worsen with the walking and climbing after genicular artery. Patient is pain-free, and you can see these are inframedial genicular arteries affected. There are lots of Moyamoya blood vessels, and after injecting these embolizing particles, the post-embolization image shows the inframedial genicular artery is intact, but the Moyamoya blood vessels disappear. So not only the knee joint, this procedure is effective for all the joints. For the frozen shoulder, heel, tendo Achilles, even the wrist, we have done lots of cases of rheumatic arthritis for wrist joint and small interphalangeal joint also. So these are diabetic patients suffering from severe night pain since last 3 years, basketball player but not able to play his game because of this severe pain, and tried so many medicines but not useful. Embolization done after 3 years. બે દિવસનો ફોન આવ્યો સાહેબ કેટલા 3 વર્ષ શાંતિથી ઊંઘવા મળ્યું એમ. So after 3 years he is able to sleep without pain and started his basketball. So these all Moyamoya blood vessels disappears within this magical procedure. So again, the tennis elbow, another joint. Patient developed tennis elbow. Professionally, he's a writer and already taken the PRP injection for tennis elbow, but it didn't work. With pain embolization treatment, 80% pain relief. So these are case of ankle pain. Patients develop the ankle pain after chikungunya infection, which is very common in our area, and suffering since last 9 months. Pain embolization done, it has relieved pain after this our treatment. Achilles tendinopathy, the classically Moyamoya blood vessels seen at the insertion site of Achilles tendon, and after this pain embolization treatment, the Moyamoya blood vessels disappear, and along with the Moyamoya blood vessels, the patient's pain also disappear. So these are case of plantar fasciitis, and this patient with heel pain suffering since last 2 years, not responding to physiotherapy, and taken one steroid shot but not effective, and pain embolization treatment has relieved her pain within the 24 hours. So basically, smaller the joint, the result is the faster. Heel pain, tendo Achilles pain will respond faster, but if we talk about the knee pain, shoulder pain, these are the complex joint, and it will take at least 4 to 6 weeks to relieve to get the maximum results. So these are case of sacroiliitis that we have done this case, and the patient is suffering from sacroiliitis, and on the left side you are able to see the Moyamoya blood vessels, and this side the Moyamoya blood vessels disappear along with the pain. So now the next question, what can we treat and what we cannot treat? So this is very important thing we learned after so many cases, that we have faced so many failure in our initial cases. So this is what we are sharing, that first we understand that we are treating the chronic inflammation, right? So we have to differentiate between the inflammatory pain and the neuralgic pain. That is a typical due to some prolapse of the intervertebral disc, and we can treat any joint, whether it's a small interphalangeal joint or larger knee joint or shoulder joint. We can treat any joint pain, but neuralgic pain we cannot treat with this pain embolization technique. And recently, Rosil got this message from one of the North Gujarat leading physician doctor. We have done the post-care embolization for her wife, and we were reluctant that we don't know whether the result come or not, but she was suffering since last 3 to 4 years, and he told us that let's see whatever the result come. And recently, 1 week back, he has sent this WhatsApp to Rosil, and he recommend that now my wife's pain is relieved so much, and you can do the post-care embolization also. So there is one more indication for genicular artery embolization. If the orthopedic surgeon fail to relieve the knee pain, as an interventional radiologist, we can relieve the knee pain of the patient. So thank you so much, and as these are interventional radiology conference, we are interventional radiologist, and we are definitely at par with the surgeons. So thank you so much.
Thank you, sir. Actually, being last batsman, you hit the fine stroke and definitely made the century.
Thank you.
And if I'm not mistaken, your teamwork with Dr. Rosil
Yes, he is my
in
partner.
genicular artery embolization
Yeah.
has been mentioned in one of the stories of Dr. Surat Thakkar's
Yes, yes,
Doctorny
yes.
Diary,
Yeah,
right?
yeah.
So it's a great honor for us to listen to you.
Thank
and
you.
I'm glad that we are here.
Thank you.
So, for felicitation of sir, I would request Dr. Nipa Patel to come up on the stage. Dr. Nipa Patel is assistant professor in radiology department, Mimer Hospital, Surat.
Thank you so much. Thank you. Thank you.
Thank you, Dr. Nipa. Thank you, sir.
Thank you.
So now we will move towards